Okay, so in this video we're going to talk about the Patient Protection and Affordable Care Act, the PPACA. And I'm recording this in November of 2013 because in politics and policy, things do tend to change. So this is going to be relevant to now, and things may change if you watch later. This is also called the Affordable Care Act, or also known as Obamacare. And for the time being, and perhaps from here on out, this will be affecting the way, the environment in which we practice medicine. So I think it's important that we learn at least the pieces of it, not just what they tell us on the news, which tends to be sensationalist and focus on certain parts. So whether you agree or disagree with it, let's at least learn a little bit about it. Now, this bill was signed into law on March 23rd, 2010. Now, this isn't actually an accurate picture. There we go. That's a little bit better, because this bill is 906 pages long. It's huge. But when you try to understand all the things that it's trying to accomplish, you can understand why it is this big. It tries to increase quality, increase coverage, which means decreasing the number of uninsured, but that also means increasing the number of things that are covered, as we'll talk about. And the last thing that it tries to do is decrease costs or increase affordability, hence the Affordable Care Act. So the fact that it's trying to do all these things leads to this guy's overweightness. The other thing is the way that this thing was designed. President Obama, looking at all the previous failed attempts, and if you think about it, the last major change to medical care was Lyndon B. Johnson's Medicare in 1965. But since then, Nixon, Carter, and even Clinton had tried and failed to change the system, and because they kept running into opposition. So what Obama did was he set out some guidelines of what he wanted in this thing, but then left it to Congress and left it to those third parties like Big Pharma and health insurers, and brought everybody to the table so they had a say in this. And so that's how this thing kind of grew to be so large, because it tries to address all of these issues. And we could talk about in a later video what that means. But for right now, let's look at what we have today. And before I go any further, I want to say that a large part of this talk is based on a talk given by Dr. Saperna Dutta, who gave a great grand rounds on the Affordable Care Act, as well as some things I've heard at the AAMC and other conferences, and just reading about it. So let's start. So we're going to need some space, so let's move our little guy over here. He's going to walk down here. And then let's look at all the things that are part of the Affordable Care Act. The first part are the consumer protections, and these are the things that had been touted earlier. The things like you cannot be dropped for having a pre-existing condition, that women are not going to be charged more just because of their gender, and older people are not going to have huge charges, and those sorts of things. And we'll talk about those in a little bit more detail. I want to first list all the things that are included in here. The next thing are the mandates, and that's the piece that states that both businesses and individuals actually have to buy insurance. They're forced to. So the mandates apply to both individuals and to big companies that have more than 50 people. It also includes these subsidies, which come in the form of various tax credits, tax breaks, and even decreases in help with paying premium for people who are poor. Another well-publicized portion of this is the expansion of Medicaid. So this is the program that states have in order to provide funding for medical care for their poor people, for people who live below the poverty level. So all of these components, they interact with each other, and we can't, of course, forget the healthcare exchanges where people can go to shop for insurance. So let's look at each one of these in turn. All right, so let's look at these consumer protections in the Affordable Care Act. And these were all the pieces that were advertised initially as the benefits of the Affordable Care Act. addressing all the problems that consumers had with health insurance. So let's look at each one of those. The first one, the most well-known one, is that you cannot be denied insurance just because you have a pre-existing condition. And this is called guaranteed issue. So let's see, this guy here, he has a bad heart. And in the past, he would have been refused health insurance, but now they can't refuse him. So now he's able to get a policy. So having a pre-existing condition is no longer a problem. Now the issue is that insurers are going to say, hey, wait a minute, if we got all these people with expensive medical conditions on our roster, it's going to be very expensive for us. So how are you going to deal with that? So that we'll look again at the mandate. But right now, guaranteed issue. Another problem that used to exist is that if you had an expensive medical problem, at some point the health insurance company could say, you know what, we've spent way too much money on you, we're going to drop you from our insurance. And then people would be left with these huge bills they had to pay, and then this is what ended up sending them into bankruptcy. In fact, healthcare was the number one reason for bankruptcy that we had. So this is called rescission. And the Affordable Care Act says, you know what, you can no longer take someone's insurance policy away. So not a problem anymore. You can't be dropped from the insurance. So this person also gets to keep their policy. And the other thing that's kind of like this is the lifetime limits on insurance, which means that after a period of time, if you've spent too much money, then they would drop you from your insurance. So if you have a young child who has a disease and by the time they're 10 they've exhausted all the money, they'll never get insurance again. So this is also gone. Another consumer protection that's included in the Affordable Care Act are minimum standards in health insurance. So previously you could buy policies that were just really bad policies. They provided minimal, very scant care, and now there are standards set, and you have to provide at least a certain amount of health care. This is going to include things such as preventative care. And along with this are maximum out-of-pocket costs. So previously, patients would have no idea what they were responsible for. And so the insurance companies are required to say you are at most going to be responsible for some amount of money. So that way patients and families can save money. So in the past, these costs used to be unlimited. Now there's a maximum set on them. And finally, the last thing we'll talk about is discrimination. So health insurance would charge more for old people. They would charge a lot more. So now they're limited to only charging 3 times the amount that they're charging young people. The cost to women used to be much higher, and so now they're no longer allowed to discriminate based on gender or based on race. In fact, the only things they're able to base their premiums on are their age, and again, there's a limit, 3 times the max, smoking, and the geographic area. And other female issues are also now covered, such as birth control pills, as well as visits to the gynecologist. So discrimination is eliminated, and premiums can only be determined by age, smoking history, and the geographic area where they live. So all these consumer protections are obviously going to cost insurers more money, because places where they could save money in the past, such as denying care or dropping care or limiting care, or charging more based on discrimination, are now gone. And so the insurers need to get some way in order to mitigate their costs, and that's, we'll see, they're going to pick that up in the mandates. But these are the consumer protections that we find in the Affordable Care Act. So the next part of the Affordable Care Act that we need to talk about are these mandates. And there's 2 kinds of mandates. There's one for individuals, and there's one for employers or companies, especially those large ones, the ones that have greater than 50 employees. So the individual mandate states that everybody needs to buy insurance if you're not getting it some other way. So you might get insurance from all sorts of different other ways. It may come from your employer, maybe Medicaid or Medicare, or you might be on your parents' insurance. Now remember that with the Affordable Care Act, you can now stay on your parents' insurance until you are 26 years old. Also exempt from these are people who are in jail. So, what happens if you decide that you don't want to pay, you don't want to get insurance? Well, then you are subject to a penalty. And this starts out at being 1% of your taxable income and eventually grows to being 2.5% of your taxable income. And this part of the Affordable Care Act, the fact that you can force somebody to buy something, was part of the thing that brought this to the Supreme Court. The opponents said that you can't force someone to buy something. You can't force commerce upon somebody. And the Supreme Court ruled that they actually are. In fact, it's a tax, and the government has the right to excise taxes on its population. And so the penalty was said to be constitutional. And so that's why, or how this remains intact. So this is how Uncle Sam's going to get some money out of your pocket by calling it a tax. Now, why do we need the mandate? Well, all the consumer protections that are in place are going to cost the insurers money. So, in order to get back this money, they need to have people paying in who also are not taking out. So these are the healthy people, the young, healthy people. They need paying into the system, so when the older, sick people take money out, the young, healthy people pay in. So the young and healthy pay in so that the insurance company can pay out to the sick. Now there's a potential problem here, and that's called the premium death spiral. So what happens if these young and healthy people decide they're not going to pay into the system? They'll take the penalty and they'll go their own way. So now what that means is there's no money coming in. And the insurer is still going to be paying out for all the sick people. So without any money coming in, the only recourse that the insurer has is to increase premiums in order to try to get some money in. But what the effect this is going to have is a young, healthy person is going to see this and say, forget about it. I'm not going to pay in higher premiums. So this young, healthy person looking at these increased premiums is going to say, no, why would I do that? I'll take that tax instead. And so that means there's less money coming in, more money coming out. Premiums have to go up again. And so this is going to spiral and spiral and spiral until premiums just go through the roof. So it's very important that they get the young and healthy people into this system in order to avoid this premium death spiral. Now that was only half of the mandate. The other part of the mandate includes companies with greater than 50 employees. So if the company can't pay, can't afford the insurance or doesn't want to buy the insurance, then it's going to have to pay a tax. It's going to have to pay a penalty. So this piece was supposed to be enacted in 2014, but the small businesses said, no, we're not going to be ready in 2014. So they said, well, fine, we'll push this to 2015, and that's when we're going to enact this employer mandate. Now, the individual mandate starts in 2014, so some people are complaining, why do businesses get an extra year, whereas the people don't? That doesn't seem fair. So what some companies are doing, afraid of this mandate and the cost it's going to incur upon them, is they note that, look, there is a 50-employee limit here, and so if we don't have 50 employees, we're safe. So the way they're getting around that is they're going to fire people to get under 50 employees, and just hire part-time workers, which do not count towards this 50-employee thing. So opponents of the Affordable Care Act say that this is going to hurt jobs because people are going to have a hard time finding full-time employment because companies are going to be laying off people and only hiring people part-time. So here we kind of looked at the mandates, and we know that there's individual mandates and there's the employer mandate, and how there's a penalty that can be paid by either the individuals might have to pay or the companies might have to pay, and the implications that it might have, like a premium death spiral or loss of employment. So now let's talk about some of the subsidies that are going to come out of this. And so there's really two subsidies going to two people. There's people and small businesses. So first let's look at the poor. And so those who are below the federal poverty level, they're going to get Medicaid. And those who can afford insurance will buy insurance. They'll either get it through their employer or they'll buy it on their own. Now what about this zone in between? These are the people who are too rich to get Medicaid but too poor to buy insurance. So what are we going to do for these people? Well, the first thing that happens is we are going to move this limit up some. So now this goes up to 133% of the federal poverty level. But who's responsible for this? Who pays this? Well, the states pay for Medicaid. And so this expansion of Medicaid, well, no state can afford that, right? Most of our states are bankrupt or close to it. And so the government is going to pick up this tab. And they're going to pay 100% of this initially. And the Affordable Care Act had initially said that, told the states, look, if you are going to expand Medicaid, great, we'll help you out. But if you don't expand Medicaid, then you're not going to get any money. You're not going to get any money at all here. You're not even going to get this money that we used to give you here for Medicaid. And the other thing that the Supreme Court decision said was that the U.S. cannot force states to expand Medicaid. And so that was dropped. That part was not constitutional, and so the states cannot force Medicaid, or the government cannot force Medicaid expansion on the states. However, what most states ended up doing was taking this anyway, because you know what, the government's going to foot the bill. The federal government's going to foot the bill for this anyway. They're going to eventually phase it out. Initially, they're going to pay 100%, and I think by 2020 they're going to end up only funding 90% of it. But still, that's a lot of money to turn away. The only states that aren't are ones with Republican governors who, out of principle, are saying, no, we're not going to take your money. We don't want to do the expansion of Medicaid. The rest, they're kind of forced to do.
Is that a big secret?
So the first thing is the government's going to fund Medicaid expansion. The other thing that they're going to subsidize are these people who are too rich for Medicaid but too poor to buy insurance. So these guys are also going to get subsidies to buy insurance, and it depends on how much money they make. The more money they make, the less money they get for a subsidy. And so who else gets a subsidy? Well, small companies do. That is, companies with less than 50 employees. If they decide to buy insurance for their employees, then the government's going to give them some tax credits. So they are going to get some money too. And you know else who gets money? It's the old people. The ones that were on prescription medications. If you remember in the Medicaid video, we talked about the prescription donut hole. There's under $2,000, the government would pay for your prescriptions. Over $6,000, the government would pay for your prescription. But in between, you're on your own. And so the government's going to pick up a big chunk of that tab now. And that's eventually going to be completely closed. I mean, they're going to pick up the whole tab by the year 2020. So the government is shelling out a lot more money than they were before, right? They're paying for the expansion of Medicaid. They're subsidizing those people who can't afford insurance and are too rich for Medicaid. They are going to give some tax credits to small companies. They're going to close the donut hole for the elderly and their prescriptions. So that's where things are going to start costing money. So far it looks like we're just spending money and not saving any money. What happened to the affordability portion? Well, we'll get to that. We got one last thing that we need to talk about, and those are the healthcare exchanges. The healthcare exchanges are a marketplace where people can go and buy insurance. Now, the way buying insurance happened prior to the Affordable Care Act was that you just went and you got a policy and you had no idea what you were getting because it was so complicated. There were deductibles and lifetime limits and all this other stuff, and you had no clue what you're getting. And so what these exchanges hope to do is try to make things a little bit easier by making you can only pick from a certain amount of things, and the insurers can only offer those things. And so you just see whoever has the cheapest one, or whichever one includes your doctor. And so what are those things I keep talking about? Well, there's several levels of insurance you can get. The first is the bronze plan, which will cover about 60% of your expenses. The silver plan covers 70%. The gold does 80%. And the platinum, of course, does 90%. So these ones will obviously be cheaper, and these ones will be more expensive. Now remember that there's also a basic level of care that is included in all of these plans. So these essential health benefits include ambulatory patient services. So this means things like when you walk into a clinic or anywhere that you can really walk into and you're not staying overnight in a hospital. It also includes emergency room visits. It includes hospitalization. So these are any inpatient stays that you may have. Mental health and drug counseling services. That's huge, I think. This is usually not covered, and the fact that it is amazing because we have such a big problem with this. Drug coverage, so prescription medications only. Rehab services, such as getting physical therapy after a stroke, learning to use glucometers if you have diabetes, any lab tests that you might get, so that means blood tests and x-rays and things like that. Preventive medicine, so that means things that prevent you from getting sick or care for chronic diseases, so preventing any complications of that. And this is actually also huge, because if we can prevent the expensive complications from happening, then we could perhaps save a little bit of money. And then also our pediatric services. And so that means anything really for pediatrics, so oral, dentists and vision care for dentists, vision care for kids, not for dentists, unless the kid is a dentist. So each one of these will be offered in the marketplace. And the thing that determines the price is, of course, what kind of plan you get. And remember, the other things are your age, smoking history, where you live, your geographic area, and the number of people, number of family members, the number of people you're going to put on the plan. So these are the things that will determine the price. And there's one more determinant of price, and it's something called the medical loss ratio. So let's say this is the amount of money that the insurance company takes in profits. That they take in for premiums. So what the medical loss ratio says is that 85% of the money taken in on premiums has to be spent on health delivery, and so they can't just make tons and tons of money. Now, if they get more profit and they're spending less than 85%, then the excess has to be returned to the policyholders as a dividend. And next year, they charge less in premiums. So this is hopefully going to put a limit on the premiums, because they can only make 15% in profit and administrative costs. Now, the thought is that at these exchanges, everyone's going to be putting their policies on the shelf, and consumers are going to come by and comparison shop, and so everyone wants to get the cheapest plan they can, right? And so that's going to force the insurers to try to make the cheapest plan, and the only way they can do that is by forcing the healthcare delivery people, that means the hospitals, the nurses, the doctors, to be more cost effective. So the thought is that this competition is going to force the insurers to tell the doctors to be more cost effective. So hopefully we will be using competition to create cost effectiveness and therefore decreasing the cost of healthcare and increasing its affordability. So this is fairly indirect, the way that this happens. So opponents of this plan from the left say there are really no good cost control mechanisms here. This is fairly indirect. There's no guarantee that cost is going to come down. We're just relying on this process to happen. So in this video, which is a lot longer than I wanted it to be, we have just examined the various components of the Affordable Care Act. The consumer protections, the mandates, the subsidies, which include the Medicaid expansion, and the exchanges. In the next videos, we'll talk about some of the other components that are going to hopefully help control costs. All right, I'll see you then.